Communication, collaboration, and ethical decision-making. Working within the complexities of the modern healthcare system, the advanced practice nurse, as part of an interdisciplinary team, demonstrates leadership qualities when influencing and empowering others. The advanced practice nurse's core strengths as a leader shine when they communicate clearly, seamlessly collaborate, and make sound ethical decisions. Research-based advanced practice nurses transform evidence into holistic best care practices when consistently maintaining a patient-centered focus. This presentation shows how these skills fit together from the beginning of the nurse's career through the transition to advanced practice nursing. It starts with quality care delivery and then the results that aims for. Next, we'll discuss the advanced practitioner's role in the ethical facilitation of interprofessional communication and collaboration, and then we will see how this all comes together to strengthen advanced nursing roles by demonstrating their use in practice to improve patient outcomes and team performance. Delivering quality care involves applying best clinical practices, staying current with evidence-based guidelines, and a commitment to continuous learning. These efforts improve not only the performance of the healthcare system, but also enhance patient satisfaction and health outcomes to ensure safe, effective, and timely patient-centered care. In 2021, the American Association of Colleges of Nursing published a framework of 10 core domains titled The Domains, Competencies, and Subcompetencies for Entry-Level Professional Nursing Education and Advanced Level Nursing Education. These domains list minimum educational requirements for all levels of nursing students and define what quality care delivery is and ensure that it is delivered. The combination of these expectations builds on the advanced practice nurse's foundations as a registered nurse. I chose 2 foundational domains to help define the role of the advanced practice nurse in delivering safe, effective, and holistic care. These domains emphasize the importance of collaboration with interdisciplinary teams to support high-quality, patient-centered outcomes. Domain number 2, person-centered care. The conceptual statement for this domain states that person-centered care is the core purpose of nursing as a discipline. Subcategories of these domains further differentiate the expectation of care based on the nurse's level of education. They focus on several things such as quality of patient care, assessment, nursing accountability, and ethical considerations. For instance, in domain number 2, when engaging with an individual and establishing a care relationship, it is expected that the entry-level nurse can demonstrate qualities of empathy, whereas the advanced practice nurse is expected to promote caring relationships to affect positive outcomes. Domain 6 defines interprofessional relationships as professional partnerships that include interprofessional, intraprofessional, and paraprofessional partnerships. Subcategories to this domain expect that when communicating in a manner that facilitates a partnership approach to quality care delivery, the entry-level nurse is expected to communicate the nurse's roles and responsibilities clearly, whereas the advanced practice nurse should be able to demonstrate effective evaluation of interprofessional communication tools and techniques to support and improve the efficacy of the team-based interactions. When the American Association of Colleges of Nursing defines quality care relationships, it states that they should build on a consistent demonstration of core professional values in the provision of team-based, person-centered care. These core values include excellence, caring, altruism, ethics, respect, and communication. Collaborations that demonstrate a quality of care delivery relationship while utilizing these core professional values are seen in both inpatient and outpatient settings. The advanced practice nurse working in the inpatient care setting can expect to collaborate with other healthcare professionals when managing a patient with chronic illness. For example, primary care providers, respiratory therapists, pharmacy, and laboratory or diagnostic technicians. They will develop the skills of interdisciplinary rounds and will take part in the development of new treatments through research. In the outpatient setting, advanced practice nurses' opportunities to demonstrate a quality care relationship will include the development of community-based safety measures through local and state health departments. Patients with chronic illnesses may require outpatient management of their illness, and the advanced practice nurse can expect to collaborate with a home health care nurse, community resources for transportation, to and from appointments, and community-based or state-based food assistance programs, and even palliative or hospice care. The availability of telehealth medicine helps the advanced practice nurse with outpatient continuity of care to reach those who may be unable to make it to the clinical setting. In either setting, the goal of the interdisciplinary and patient collaboration is to create a comprehensive care plan, so providers should frequently discuss patient cases to ensure that everyone is aligned with the treatment plan and communication is consistent among providers. Administration, management, and research. No one is more equipped to lead this charge in the work setting than nurses who have the education and knowledge of the policies, regulations, culture, and their own work environment. Advanced practice nurses in administration, management, and research positions are forerunners for the integration of current and relevant health policy and standards within both the inpatient and outpatient settings. In alignment with the achievements set out by the quadruple aim, nurses in these positions are credited for increased adherence to guidelines, improvements in the work-life balance, improved quality and safety for patients and healthcare providers, and enhancing care models through evidence-based practice implementation. Facilitating partnerships. Outside of improved patient outcomes and higher job satisfaction, it is beneficial for nurses at all levels of practice to facilitate partnerships with other multidisciplinary team members. These partnerships are designed to promote clear communication, mutual respect, and shared goals across interdisciplinary teams. Nursing is a field of continued learning and professional growth. Facilitated partnerships between academic institutions and healthcare settings for the student nurse all play a part in shaping who we become through improved education and mentorship. Wilson and colleagues in 2021 found that gaining a deeper understanding of the role of the healthcare team through guided facilitation will lead to greater role fulfillment and increased job satisfaction. Once the student actually becomes a nurse, she can plan on having multiple facilitated partnerships with her patients, her colleagues, her nursing supervisor, her charge nurse, administration, respiratory therapist, hospitalist, nurse practitioners, pharmacists, laboratory technicians, as well as family members. And finally, upon successful completion of board certification, the advanced practice nurse in the state of Illinois, where I live, which is a restricted practice state, is required to enter into a collaborative practice agreement with the physician. This CPA should clearly outline the advanced practice nurse's scope of practice and have clear guidelines as to collaboration and consultation with the supervising physician. After fulfilling the supervised practice hours and further educational responsibilities, the advanced practice nurse will gain full practice authority while consulting with the physician in some incidences. Choosing the right communication tool is just as important as what is being communicated. The right communication tool can help improve efficiency, transparency, continuity of care, foster feedback, lead to increased patient satisfaction, and improved clinical outcomes. With the development of patient-centered healthcare system models, the patient is placed at the system's center, allowing full participation from decision-making to assessment and evaluation. The first tool I'm going to discuss is called the SBAR. This stands for Situation, Background, Assessment, and Recommendation. When contacting the physician with concerns related to your patient's condition, laboratory values, and medications, this tool provides a streamlined approach to communicating the issues and promptly establishing interventions. In the situation area, you are going to briefly describe your immediate problem or concern with the patient. You do want to include your name, the patient's name, your location, and the reasons for your concern. For the background, you're going to want to include any relevant context or information about the patient, such as the patient's admitting diagnosis, their history, any current symptoms or current medications, laboratory values, and you also want to include any interventions that you have already tried. The assessment portion is just like it sounds. Here you're going to want to include, like, if you've already put oxygen on the patient, if you've done serial blood pressures, and you also want to state your professional opinion and evaluation of the situation and its severity. And finally, the recommendation. Here you want to clearly state what you need from the other person, whether it's a checkup, treatment option, or further testing, or additional medications. The next important communication tool we have is clinical rounding. Clinical rounds are essentially for interacting with providers and patients and can help develop a good doctor-patient relationship. Medical students, residents, and advanced practice nurses will learn valuable hands-on medical skills from conducting patient interviews to physical examinations. With the goal of promoting team-based learning and multidisciplinary collaboration, these clinical rounds are also important for patient and family education and can help patients and family members with making better informed decisions about their health care. Working in the healthcare field, at one point or another, we're all going to be faced with making some tough ethical decisions. Here is a list of a summary of the 7 steps of ethical decision making. I will refer back to these as I relate them to 2 specific case scenarios on the next slide. I'll give you a moment to glance through these before I proceed. Unfortunately, we have all been there. We all know at least one, and even just seeing the words toxic work environment may conjure up an image of a specific person. A toxic work environment can quickly lead to burnout, and we have all heard horror stories of how nurses eat their young. Using the term toxic broadly, it encompasses not only bullying from other nurses, but physician and patient bullying as well. According to Wilson and colleagues, physicians undermining and having a lack of respect for the role of the nurse practitioner has led to early burnout and dissatisfaction with their career choice. Overall, a toxic or unsupportive work environment contributes to staffing issues and can have an impact on employer and patient satisfaction. The American Nurses Association Code of Ethics Provision 6 states that nurses must maintain a safe work environment and advocate for a culture of respect. A widely used tool for ethical communication dealing with issues of this nature, developed by a program called Team Steps and endorsed by the Agency for Healthcare Research and Quality, the CUST system of phrases is utilized when to help a person determine whether or not they're in an ethical situation. The C stands for I'm concerned, the U, I'm uncomfortable, and the S for this is becoming a safety issue. Now, let's briefly go back to the 7 steps of ethical decision making, and we'll go over a couple of the steps just to see how this could benefit the advanced practice nurse in making her ethical decisions. We've already identified the problem, a client's or a colleague's hostile nature and undermining behavior is affecting your emotional safety and the team dynamics. We've applied the code of ethics. Let's consider the potential consequences of all of these actions. Had we filled them all out. Direct confrontation could improve your clarity, but it could also worsen the hostility. And reporting through official channels may protect you, but it could take longer, feel risky, and again, worsen the situation. Another common ethical scenario faced in healthcare deals with the patient's right to refuse medical care and patients leaving against medical advice. Whether it's related to mistrust with the healthcare system, unreliable internet searches, or they heard it from a friend, or even fear, patients have the right to refuse our help. The American Nurses Association's Code of Ethics Provision 1 states that we must have respect for the autonomy of our patients, and Provision 2 states that we have a duty to advocate and to educate our patients. For this example, we are going to use the ethical framework called ASK. In ASK, we determine the patient's understanding of the recommended medical course of action and their concerns or fears related to it. For TELL, we discuss the essential facts about the treatment plan, clarify any misunderstandings, and explain the rights and risks of refusing medical intervention. Finally, in ASK, we go back over everything to determine if there has been a better understanding, if they have any further questions, and if not, we must support the patient's right to informed decision-making. Again, relating this back to the ethical considerations, we've identified the patient problem, we've applied the code of ethics, determining the nature, we're trying to balance the patient's right to refuse our care with our obligation to prevent harm, and finally, in our implementation of the course of action, we must respect the patient's informed refusal and document this conversation clearly and involving other team members if needed. As disheartening as it may be, we have to realize that we did everything we could and respect the patient's decisions. We move on now to advanced practice registered nurses' leadership roles. Leadership versus administration. People may use the terms leader and administrator interchangeably, but they do have distinct differences in thought and managerial structure. I've heard it said that every administrator can be a leader, but not every leader has to be an administrator. And finally, a nurse leader is defined by her actions and not always by her position of authority. There are many different leadership roles suitable for the advanced practice nurse. Each advanced practice registered nurse has a unique leadership role to cultivate regardless of title. All advanced practice registered nurses should exhibit leadership qualities that influence and empower others. First, we're going to discuss clinical and direct care leadership. In this, you can expect to find clinical nurse leaders or charge nurses. This profession will focus on collaborating with interdisciplinary teams to deliver high-quality care while also working in a managerial position to improve patient outcomes and coordinate teams, staffing, and compliance. Next, we're going to discuss opportunities in administrative and managerial leadership. In these positions, you can expect to find the nurse manager, chief nursing officers, director of nursing, and healthcare administration. These professions will combine their administrative duties with leadership qualities, focusing on both maintaining efficient operations and inspiring a team to achieve the company's mission, vision, qualities, and values. Next, we have our education, advocacy, and policy opportunities. Under this, you can expect to find nursing researchers, health policy leaders. These are advocacy groups who use their expertise in areas of research and evidence-based practice to lobby for specific policies. These include increasing funds for schooling, requiring better education for teachers, and providing equal opportunity, all-inclusive student access. As you can see by the many quotes I've included on this page, while there is still some job dissatisfaction and problems with role identity, There is overwhelmingly positive feedback related to nurse practitioners. While it's clear that advanced nurse practitioners improve patient satisfaction, clinical outcomes, and adherence to treatment plans, new graduates and those working under collaborative agreements still face barriers to practicing at the full scope of their training. These challenges can lead to frustration, burnout, and job dissatisfaction. Advanced practice nurses do make a significant difference, not just by treating patients, but by how they lead, communicate, and work with others. Whether it's at the bedside, in the boardroom, or in the community, their ability to listen, collaborate, and lead is what drives better outcomes for everyone involved. Demonstrating strength through influencing change, integrity through patient-centered care, and resilience in the face of adversity will lead to the changes necessary for recognition and validation of the profession. Always remembering that it is not just what we do, but it is how we do it.